Hey guys, ECRG here, back with another episode. Today I've got an interesting episode for you guys today. It's from a subscriber on YouTube who emailed in about them wanting to be a CTA, which is a clinical trial assistant at one of the CROs, and they are not interested in the CRA career path. They are not interested in that advancement path. They want to know what kind of other options are out there for them to do. So I'm going to read their email and then give my take on their question. He said, "Hi, I've been a longtime follower of your channel and appreciate your great insights. Recently, I'm thinking about being a CTA, but I know the most common advancement path would be CRA. But I'm really a family person and traveling so much would not be an option. So are there other options that I could look into starting as a CTA? Preferably with a similar salary range as a CRA, but not so much traveling. Also, I recently got an interview notice from a CRO. My resume is attached and is mostly all wet lab research experience. Luckily, this role doesn't require clinical experience. So what would you recommend me to emphasize during my interview? Resume is attached. Any feedback would be appreciated." So this person wanted some resume feedback also. So for those that are interested in having their resume reviewed, you email me at eliteclinicalgroup@gmail.com. I will then let you know about all the different services and options we provide for you guys looking to break into the clinical research field. This is great for those type of people who have maybe applied to a few jobs or many jobs and haven't gotten any feedback, or their resume has just been tossed aside. We will break down the reasons why that may have occurred and how to improve your chances the next time around. So thank you for emailing in. We will, first of all, to break down the most common advancement path from CTA is, of course, CRA, as you mentioned. But there are a couple other pathways that you can go down on. One being the project management side. So you can move over to sort of like a project management assistant or a project specialist type role. I forget what they call it at this company, but it's like maybe an assistant project manager, I think they call it. So that's a good career path too if you're not interested in being a CTA or being on the clinical side. Another thing that people do is they stay at a CTA for a little while and you could become a CTA line manager. So that is always an option if you want to, not be a CRA and travel. You can stay on and be a line manager and kind of go up the ranks that way. Typically, if you want to go up the ranks of being an executive, and I mean, as it stands right now, you're not interested in travel, so I don't think an executive would probably be a good fit. But typically, project management side is how people rise through the ranks and become those VPs, those project directors, those type of positions in the company. They do that through the project management side. And then another role that you could do is an in-house CRA. Obviously, you don't have to stay at the same CRO. Once you get some experience, it becomes easier to move. So there are other CROs or other pharmaceutical companies that have in-house CRAs. And that's going to be basically like a CRA, but you're going to be doing a lot of the work from your house. So, calling sites, following up with action items, issuing queries, things that the CRA doesn't have time to do, putting things in TMF. Things of those nature. So in-house CRA is also a good path if you really like clinical. And I've talked a lot about on this channel, why I think people should be CRAs, why I think you should be a CRA, even if you're not interested in travel, you just want to do it for a year and that's it. I do think a lot of people would get a lot of benefit from being a CRA because there is a certain amount of understanding you get from going on site that you don't get from just being, locked in a cubicle. Not to mention, it's a great experience traveling all over the country, going to places you haven't been before. It's typically a big salary jump that you're not going to get from other positions. And once you're at that salary level, they have to kind of maintain that salary level for you. You do not have to be a CRA forever, guys. And I know a lot of people don't want to be CRAs forever. So I definitely would still recommend it, even if you're not going to be able to do it long term. And a lot of people do move from it. I mean, it's a lot easier to move up as a CRA than other positions. And a lot of people can move into project manager roles more easily. I've seen people go from, CRA into like a project manager level 2, just like that. because of that experience. So it is a very worthwhile experience, and there's a reason why CRAs are paid what they're paid. I don't get it twisted. It's a lot of work, but there's also a lot of happiness that comes with it, a lot of freedom that comes with it, a tremendous amount of freedom, and a lot of perks that come with it, a ton of perks that come with it. So I definitely think people should look at it and potentially go for it. But if it's not for you, it's not for you. So yeah, I think that answers your question. Like he mentioned at the end, if you are interested in any type of resume review or anything like that, you can email me eliteclinicalgroup@gmail.com. And I think these are the most common paths for CTAs that don't want to travel. And oh, wait, one more. I have heard of some CTAs going from CTA to being a study coordinator. Maybe you want to have more interaction on site with the actual patients and the PIs and have more hands-on to the research. So I have heard of that happening too. But that's, of course, rare. Once you make it to the CRO or pharma level, you pretty much stay at that level. But I have heard of that happening too. So that's also an option. So yeah, hope you guys enjoy this episode. We're going to have a lot more content coming soon. Take care, guys.